We now know that periodontal disease causes inflammation that leads to heart attack, stroke, diabetes, preterm birth, and even some cancers. 50% of Americans have periodontal disease, but only 3% are getting treated. If you have periodontal disease, you double your chance of becoming diabetic. And if you're diabetic and you have periodontal disease, you increase your chance of dying from diabetic complications by 3 times. You can also increase your risk of heart attacks by 72%. Your hygienist can show you how healthy you are in regards to periodontal disease so that you can reduce these risks by answering 6 questions. The first is, do you have active infectious periodontal disease? That's determined by bacteria. Periodontal disease is a bacterial infection. So she will measure the dangerous anaerobic bacteria that causes this disease. Then we want to know, has this bacteria just in your mouth or has it traveled into your bloodstream? If it has, it may be causing chronic inflammatory issues, and your body may have a tough time processing sugar. So a simple finger stick will allow her to gather some blood so that we can determine if you have chronic inflammation and how well your body is processing sugar. The next thing we want to know is, to what degree is this affecting your risk for heart attack, stroke, diabetes, and so forth? And we'll be able to use these tests to determine that for you. We also want to know then, how do we best get rid of it? And did it work? Did the therapy work? So we will measure you before and after therapy so that you will know if the therapy actually put that periodontal disease into remission. We also then want to know, did it come back? So at each visit thereafter, you will be doing a 5-minute test to make sure that this bacteria has not come back. Most hygienists will measure the amount that your gums have pulled away from your teeth. And this measurement in millimeters sometimes is called pocketing. She will measure this, and if you hear anything over 3, then you know that is not normal. Most hygienists will also tell you whether or not you have bleeding areas. Bleeding is always a sign of infection in the body, and it is not normal. So she will be telling you if you have bleeding sites. But on top of that, you'll have some tests you probably haven't had before. One test is going to be able to tell you if you have the gene that causes periodontal disease. About 30% of the patient base has a gene that makes them more likely to get periodontal disease, and they have a stronger inflammatory response. We will also measure those bleeding points and the pocketing depths with a computer because it's more accurate, and the computer will actually talk to you, and you'll be able to see 1 tooth at a time how well you're doing. We're also going to do a bacterial analysis for you, and we are going to be able to tell you your inflammatory level and your body's ability to process sugar so you can assess your diabetes risk. When we start your appointment, we're going to start by taking a blood pressure. This is a full health assessment, not just a cleaning, and just like medical doctors, we want to know how well your blood is flowing through your body, and our blood pressure is a simple way to scan that. We're also going to talk to you about your health history, get the names of the doctors that you're working with, and ask your permission to speak with them so they can better monitor your prescriptions while you're in therapy. We will also ask about your family history so that we can see, is there a pattern of inflammatory disease that runs in your family? If there is, we will be giving you a free assessment as a gift from you for your family member so they can be assessed. It may be the most important doctor's appointment that they have. It may save their life. If you don't do anything about periodontal disease, eventually you will need gum surgery. And so we want to avoid that, because even when you have gum surgery, then the disease can come back. That's what makes it a vicious cycle. Know that this does not hurt, and there's no additional fee for this appointment. Just sit back and relax, and together we'll learn about your level of health, and we look forward to helping you reduce these levels of inflammatory diseases and these very dangerous diseases, and help you to raise your level of overall health.
Come visit us and check out our office. Make an appointment and find out what we can do for you. We look forward to meeting you and seeing how we can achieve together optimal health.